Welcome back, everyone. Today's episode is what high-performing healthcare facilities do differently, lessons in operational efficiency, and I could not have picked a better guest to bring the topic to life today. Steve Craig is a VP of Sales for the Central Region of Solmetex, a company whose entire mission is making dental and medical practice operationally cleaner, safer, and more compliant. Their portfolio covers water safety, amalgam separation, and aerosol control through the Solmetex, Sterisil, and Dry Shield brands. Steve is a 7-time President Club winner, a 30-year healthcare sales veteran, and someone who has spent the last several years squarely at the intersection of compliance, infrastructure, and practice growth. If anyone can tell us about how high-performing facilities are actually doing differently, it's this guy. Steve, great to have you on.
I appreciate the opportunity to have a conversation with you, Norman.
Absolutely. We're happy to have you, definitely. So I'll go ahead and get right into it. So for our audience, practice owners who are deep in the day-to-day, where does operational efficiency most often break down in the dental and medical practices, and why is it so consistently the last thing that companies address?
Well, I think there's a couple reasons for that. One, compliance is a main thing, but it's not always forefront of the CEO, CFO, C-suite, objectives of what they're looking at. And the other portion of it is to have strong clinical SOPs. People have to perform those, which, some people are great at doing that. The other challenge is a lot of times whoever's running that in the individual offices or overseeing regions, a lot of times those individuals are voluntold that they're in charge of this versus finding somebody who wants to volunteer for this. Somebody is really adamant about making sure that we're following the compliance standards and making sure that the SOPs are being followed. I always recommend to find someone that wants to volunteer for that position inside the offices, but that doesn't always happen. And then, like I said, a lot of it's out of sight, out of mind. Especially when it comes to dental unit water lines. If you had a swimming pool and it's visible and you didn't test, shock, and treat that swimming pool, the average dental practice is open 3 days a week, 7 hours a day. And if you didn't really treat that swimming pool, you'd start to see after about a week, you probably wouldn't want to go in that pool. Well, a lot of what happens in our world is in the floor, in the chairs, in the walls. It's back in mechanical rooms. So it's not as visible of what's going on. So that also kind of takes it out of sight, out of mind. So I think it's a combination of all that. It is very important to protect the organization from compliance, from legality, from risk, from contamination, from patients getting harmed. But it's really bringing that out of the back of the house to the front of the house and making it visible to everybody.
I understand. Thank you for that. So when you walk into a high-performing dental or medical practice, one that has operational efficiency generally dialed in, what are the 2 or 3 things you can see almost immediately that separate them from practices that are just getting by?
Yeah, I think for starters, they have dedicated protocols that they're following. Like I said, someone is in charge to make sure those protocols are being followed at the office level. If it's a multiple of offices or hospital setting, whatever, making sure that, all the practices are doing the same thing. They're set up the same way, following the same procedures, using the same products, and that person's in charge of that. Then they're also, making sure they're tracking what's taking place to make sure everything was completed. As I said, it's a lot of humans that need to follow those procedures. And then from there, they're reporting that back to their C-suite of what's taking place, what's going good, what's not going good. But a lot of it is just really paying attention to it, staying on top of it, and having somebody that really wants to champion that in each office regionally, and then overseeing it on a national basis. Those are the best ones that I see out there.
That's good to hear. Thank you for clarifying that. So most practices owners treats EPA and CDC compliance as a necessary expense, something to manage, not leverage. But you work with facilities that flip the script. What does it look like when a practice actually uses its compliance infrastructure as a differentiator, operationally and in how it positions itself to patients?
Yeah, absolutely. There's a lot of different things that the best do that the rest do not. One, like I said, they take it very seriously, but they also use it to their advantage. Right now, currently in the U.S., about 70% of dental practices don't test, shock, and treat their water lines. So the ones that do follow that procedure and have protocols in place, they're using that to advantage to on social media, on marketing inside the practices to let people know that we take this seriously. We have clean water. These are the policies and procedures we walk through. I think the other thing they do extremely well is they explain not only to the C-suite, but also all the way down to the end user of what is the why behind having a custom protocol? What is the why of what we're trying to get to? And I think once you kind of bring everyone to the same page of understanding the why we're taking this so seriously, why we have this protocol, why this protocol needs to be followed, how we can help keep our patients safe, how we can keep our team safe, as you talked about with aerosols. Prior to COVID, we thought the aerosols came out of the patient. So if the patient presented to a practice, without a running nose, watery eyes, sneezing, coughing, we assumed that the patient's safe and the teams are going to be safe. But what we learned during COVID was, 78% of the aerosols are coming out of the dental unit water lines. And with 70% not test, shocking, and treating their water, it now explains why dentistry has a high rate of eye infection, ear infection, upper respiratory infection, nasal infection with the team members themselves. So we do have a device, as you spoke about, called Dry Shield, which is able to capture 96% of those aerosols. But I think when you explain the why that we want to test, shock, and treat our water lines, why we want to manage the amalgam coming out of the practice, why we want to manage the vacuum lines to make sure they're clean and efficient. Once that why is understood, then people want to get on board, that they want to follow. Like I said, we're working on the other side of EBITDA. This is really the soft side of EBITDA of making sure that we're compliant, making sure we're doing the right things, protecting ourselves legally. That's where you'll see the multiple change when you go to transact or when you look to do something differently. And it makes you more of attractive of a practice or a group of practices to purchase, but it also makes you more of attractive where patients want to come. And at the end of the day, patients vote with their feet. Patients don't necessarily know a great clinical experience from a bad clinical experience, but they know how you made them feel. And if they see dirty water, if they see that you're following the little things, that probably means you're following the big things, which gives patient satisfaction and wants them to return to your practice. Like I said, they're going to vote with their feet of where they go access care.
I understand. Thank you for that. So, Solmetex positioning is a complete water management system in, through, and out of the practice. Fast Check 15, the Sterisil SafeWater Protocol, my solution center. When a practice implements this as an integrated system rather than a collection of individual tools, what changes for the team from a resource allocation and time standpoint?
Yeah, what we try to do is take what the procedures are already doing. How do we simplify those? How do we simplify the solutions they're doing? As you stated, Solmetex is the only comprehensive end-to-end water solution organization. What we do is we handle the water coming in, the water traveling through the practice, the water traveling through the patient, and the water exiting the practice. So Sterisil works on that front end of making sure if you don't have good, clean, quality water coming into your practice, we have systems that can clean up the water before it even enters the building. Sterisil works on the test, shocking, and treating side of things. Dry Shield is where the water's crossing over the patient. Like I said, it's an isolation device. It holds back the cheek, the tongue. It has the suction for that assistant. So staffing shortages are a real thing everywhere in the world. Well, they're a massive challenge in dentistry. So if a doctor doesn't have the appropriate amount of assistants, it allows them to get through a procedure using this device. If they do have the appropriate amount of assistants, it really allows them to get back to four-handed dentistry where they can really speed up the process, speed up the experience for the patient. And like I said, patients are going to vote with their feet. But it's also, like I said, capturing those aerosols to keep the team safe. And then, Solmetex also works on the amalgam capture and on the vacuum line side of things as the water's exiting the practice. And then we also do have a whole surgical division to our arsenal of a company called Oxygen. So what we do there is surgeons don't use saline every single time they treat patients. A lot of times they're using whatever comes out of the dental unit water lines. So first we make sure that those water lines are clean, safe, and efficient, because we've now, whether we're doing a socket preservation, extraction of a tooth, a pulpotomy, which is a baby root canal, we're opening up the bloodstream of the patient. So we want to make sure that that water is safe and compliant for those patients. And then secondly, then we go into training them of how to do socket preservation more efficiently, more cost savings, and how do you enhance the experience and enhance the clinical outcomes. So that's how we handle the water coming in, through, and out of the practice. So I think where that really helps with the teams is it's kind of a one-stop shop. You're working with the same person all the way through the process. You know who to contact. There's going to be times where you need to remediate because you fail a test. There's a water outbreak. There's a water boil. Any of those type of things in your area. That we have a whole team also that works on the tech side of things, of how do we fix that, how do we change that, and how do we get the operatories and the water back to where we need it to be if we ever need to go through that process. But what it really gives them gives them relief of mindset, of making sure that they know who to contact, what's the protocol, and like I said, we spend a lot of time explaining the why of that before we go through the implementation process of setting them up on that protocol. That helps the teams embrace this, and obviously it gives you a huge advantage over the competition.
I understand. Thank you for that. So the practices in our audience are navigating a real shift, moving away from fee for service, competing harder to get high value patients, trying to differentiate. Is there a direct line in your experience between how operationally tight a practice is on compliance and infection control and the kind of patients it attracts and retains?
Yeah, absolutely. I mean, that's part of our secret as well, of having that one-stop shop. It's going to make things a lot more cost effective. We have gold standard products in almost every category we're in. So one, that gives them peace of mind. But also when you start bundling all these products together, it's a lot of cost savings to the individuals, to the practices, to the groups of practices. So that allows them to give them peace of mind as well, that they're not only using the best products, they're also the most cost-effective products to get them through. And we're able to cut a lot of costs of labor by using the same products. They're all smart products. They all work together. They eliminate steps along the way of how do you make the team's life easier of following that protocol. There's a lot less steps involved in test shocking and treating your water lines. When you're using a strong vacuum line cleaner that eats away the debris in the lines and in the amalgam separator, it's less times you have to go in and change out those collection containers. So where we give them is that peace of mind of you're working, like I said, with one organization, you're using gold standard products, but they also are smart products that work together to eliminate a lot of steps, where if you're using 6-7 different companies to handle this water in, through the practice, through the patient, out of the practice, it would add a lot more steps. It would add a possibility of adding a lot more cost, and not having that peace of mind that we offer.
No, absolutely. I understand. So, practice owners are being sold technology from every direction right now. EHRs, patient engagement tools, scheduling platforms. Where does compliance and water safety technology sit in that stack? And how do performing facilities think about integrating it without creating more administrative burden for the team?
Yeah, like I said, before, that's where it really comes into. Everybody wants to implement new technology. Everyone wants to implement AI. There's only you can pretty much only implement one new procedure per quarter, per year, depending on the size of the group, the efficiency of the practice, and those type things. So this is something that is taken serious. Like I said, we don't want patients getting sick. We don't want to go through water outbreaks. As it sits right now in the U.S. today, there's only 2 states, Georgia and Washington, where they require you to test, shock, and treat your water lines. 23, it's recommended. The rest are free for all. But to make your patients safe, to make your team safe, it has to fit into that. So that's where we take a lot of that burden off them, of really, like I said, building that custom protocol, rolling out that implementation process with the office, really selling to the teams the why behind the reason the group is taking this seriously, why we need to make sure that we're, handling all things possible when it comes to water entering the practice, through the practice, more importantly, through the patient, and exiting the practice. So we're able to take a lot of that burden off them, which allows them to open up other things. We also have a tool that is free to our customers that allows them to track this whole process. So like I said, it's up to people to follow the protocols. So with this free tool, they can get on, they can check to see, did they follow the amalgam rule and change out their collection containers when they should? Did they change out their amalgam buckets when they should? Did they test, shock, and treat when they should? So it's a tool that's there to help out whoever's probably at the top or the regional level or the office level, to make sure that people have done what they need to do. And then a lot of it is, the other thing we really work on and try to perfect is, The number one killer of any business is this is the way we've always done it. Just because we have the gold tier products, we don't want to sit on our laurels of that. We're constantly looking for smarter ways, better ways, newer technology, newer products to introduce. Last year we introduced Fast Check 15, which is an in-office 15-minute water test. The closest test on the market is 24 hours. Most of the mail-in tests are anywhere from 3 to 7 days. So it really enhances the availability of speed to know that your water is safe and compliant. So we'll continue down that path of finding ways to make the lives easier. And like I said, really simplify the solutions they're already using.
Thank you once again. So the regulatory environment in the dental and medical is only getting more complex. EPA rules, waterline standards, infection control protocols. From where you sit, what should forward-thinking practice owner be paying attention to right now to make sure they're not reacting to regulation but getting ahead of it?
Yeah, like I said, there's a federal law when it comes to amalgam capture to make sure we're keeping the community's municipalities safe. Making so you always want to be reminding your teams of that. That was passed in 2017. It went into effect in 2020 when the deadline they had to do that by. So it's always giving them the reminder of that. When it comes to dental unit water lines, testing, like I said, there's only Georgia and Washington currently, but we have California, we have North Carolina, South Carolina, Maryland, New Jersey that have either submitted legislation or talking about the legislation. So I think a lot of it is how do you get ahead of that? The reason why Washington and Georgia came on is they've had so many outbreaks that they couldn't afford to look the other way. California has the largest outbreak that's ever happened. And unfortunately, there was a lot of kids that got sick during a pulpotomy from contaminated water lines. And when I say sick, I'm not talking a small little illness. These children, unfortunately, were hospitalized, went through major procedures of surgery. They were put on antibiotics, probably for life. And these antibiotics are used to cure leprosy. So unfortunately, these children lost teeth, they lost jawbone. They have the opportunity to have organ failure from these drugs they need to be on for the rest of their life. They got disfigured in surgical cases. So what we're really trying to do is how do you get ahead of the game? How do you prevent that from happening? That is a PR you do not want, a PR nightmare you do not want in your practice. So the more you get ahead of it, and I think a lot of it's just the golden rule. Pretend like you were in the chair, one of your family members is in the chair. And that's where a lot of team members have conversations with us around how we do that. Because if you truly work in that dental practice, you probably view your dentist as a great dentist, and probably yourself and your family is going to that practice. So making sure that they're following all the guidelines, all the rules, all the laws, to not only keep the patients that enter that practice safe, but how do you keep your team members and your family members safe?
I understand. Well, Steve, this is exactly the kind of grounded operational perspective our audience needs to hear. You've connected compliance, patient experience, and practice performance in ways that makes it really actionable. We do thank you for your time and your openness.
I appreciate the opportunity to have the conversation with you. If any clinicians or any offices, want to have a conversation, probably the best place is scraig@solmetex.com to reach out to me. We have inside teams that make sure that the offices are ordering on a regular cadence, that they need to follow their protocol. A lot of our products are used either quarterly, semi-annually, or annually. We have outside teams that are out in the private practice world. We have enterprise teams that are out in the DSO space for corporate dentistry. And then we also have teams that are out in the surgical space. So we have someone that can come out and help you. And like I said, we have a whole remediation team that works on the tech service side of things to making sure that if you do run any issues, you're able to be supported the way you want. So, solmetex.com is our website. And like I said, my email address is scraig@solmetex.com. Reach out if our team will help you get through whatever you need to get through.
Yeah, thank you for that. Thank you for mentioning that. Is there anything else that you'd like to just mention on the podcast call that you may have just glanced over? Anything that you'd like to talk more about?
No, like I said, I think the two biggest secrets to the like you said, the very successful practice from the practice that aren't as successful. One, somebody will volunteer to take a lot of this on at the practice level, at the regional level, or at the national level, and to really build that custom protocol. But where the biggest success comes is when we're able to explain the why we're doing this, what's important to this, why we need to be doing this, and why we're making the changes we're making. I don't think humans fear change; they fear sudden change. But I think if you always explain the why we're doing something, it's a lot more palatable for them, and then they can get on board and really not only, like I said, protect themselves, but protect the practice, protect the patients, and all that, and more importantly, protect the municipalities and the communities and the environment that we all live in.
That story with with the kids is pretty serious, and how important it is to take care of make sure they have clean water, and without any type of chemicals and stuff in their system running in dental offices, because these type of challenges can definitely happen. So thank you, Steve. Really do appreciate it.